morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Well, it must be Thursday, and absolutely it is. Good morning. I'm Jim Stallings, along with Kay Murray, and this is the Health Talk program. Good morning, Kay.
Good morning, James.
Today we're talking about FastCare, and our old buddy Tom Cole is in the studio this morning. Good morning, Tom.
Good morning, Jim.
I don't mean old buddy. It's just that, we've known you a while, and you're a frequent guest on the program. Now, FastCare is an alternative to what?
Well,
Slow care. I'm sorry.
I would say it's an alternative to if you need quick care, don't have time to make the appointment, you're feeling bad. FastCare is a good option. It gives you a place that you can go, get in and out quick, no appointments required. And also it's a great option for people that don't have insurance, $52 for a visit there. So it's for that type person, it's a great option.
It is hard educating people that they don't have to go to the emergency room for some of the things that they do go for. And then they complain about the wait and they're not getting seen, and they complain about those things. For instance, people with the flu that maybe need a shot or something like that. Or I don't know, maybe you should tell us what kind of services you provide there, that people could go there rather than the emergency room.
Well, it's basic services. I mean, we don't have any x-ray facilities on site, so it's the colds and the I don't feel good when it's a minor illness. So it's a good option for those. We offer very few lab tests on site, strep throat, those type things. It has been extremely busy with the flu, as you were talking about. I think I saw in the paper the other day, I believe West Virginia's topped the 10,000 reported cases of the flu, which is the highest since in the past 5 years, I believe is what it said.
Wow. Glad I got my flu shot. Aren't you, Kay?
I am glad I got my flu shot, but unfortunately, not all the flus will come under that flu shot, and you can still get a bug. If we've seen that around the radio station, a lot of people around here have been sick.
Yeah, they've been talking about a stomach virus or something that
Yeah,
some
I
people
think
have
that's
had.
been going around quite a bit too. And for the people that haven't got the flu shots, they are still giving them at FastCare, by the way. So it's $20 for a flu shot there also. So.
And where is FastCare?
FastCare is located in University Town Center, Giant Eagle. It's located inside the Giant Eagle.
And I know we've talked about this before. In going in, you kind of want privacy. How do you make that happen for us? That we'll get some privacy there?
Well, it is a private setting. I mean, it's separated off from the rest of the store. It has an exam room with a door that's closed on it. It has a registration area. So one of the things that Mon General prides herself in is patient privacy, and so we've taken that into consideration there.
And you mentioned the $55. $52. Will you bill our insurance company?
Yes, and we accept basically every insurance in the area. It's any insurance that Mon General Hospital would accept, they will accept at FastCare.
Okay, and it is efficient. And tell us about who staffs this FastCare.
It's staffed by mid-level providers, being nurse practitioners and physician assistants. There's somebody there during all the open hours of it. It's a one-person operation. They do the registration, they see the patient, so it's a pretty efficient little operation.
Why did you decide to locate there? I'm just curious, rather than in a whole separate building or an area. Why there? You're wondering yourself. I can tell by your eyes.
Yeah, I'm not 100% sure of the reason for the choice there. Retail health care was new to West Virginia when FastCare came to the Giant Eagle. So throughout other parts of the country, it was pretty common for them to be located in grocery stores.
Really? I didn't know that.
In the retail setting. And one of the things, I think it was a partnership with Giant Eagle because of their pharmacy. So Giant Eagle does have a pretty aggressive pharmacy program, and we thought it would be a good mix and a good marriage to be with them.
And a lot of people going in and out all the time, making it convenient, I'm sure. But I would think it'd be something. Can you make an appointment, or you just stop by?
No, it's strictly just stop by, walk in, and typical appointment or time there is usually around 15 minutes from the time they get there until they're back out the door. So that was one of the things, to keep in mind. It's again, the retail, everybody's in a hurry today. They want something quick. They want in and out, and that's a lot of the concept behind it.
I'll throw this to Jim in just a minute, but first, what are the hours there? Do you run by the store hours or your own hours?
It's at University Town Center, Giant Eagle. It's 9 to 8:30 Monday through Friday, 9 to 7:30 on Saturday, and 10 to 4:30 on Sundays. So anybody can just walk in at any time. You don't have the wait that you would normally have if you went to the emergency department. If other people were, suffering from far more serious type of situations, you could get in, get out, $52, bill your insurance. It includes the lab. It's just, as far as efficiency for your health care for minor issues, it's really the best way to fly.
And that voice comes from Greg Keeley.
Yes, Greg Keeley is the communications expert with Mon General Hospital and our liaison here with WHAR.
Exactly.
That's the lovely golden tones you have.
Those are really nice descriptors you had for me, better than I usually get from you two, so thank you so much.
You're
thank you very much.
Better from him.
Tom.
And one thing that I wanted to bring up, too, with regard to this is we talked about the location choice for this. Well, Morgantown and that whole area, Granville, has grown so fast. Granville has become somewhat of a nerve center for this whole area. It's right off the interstate, and you have Target and Walmart, all those other retail establishments, all those great restaurants, and it's just really a natural for people to want to, if they have some kind of minor issue and they're not feeling well, they can get right in there and get taken care of. Even the employees that work at those areas, they're probably, I'm going to say 7,000 or 8,000 employees who work just in that concentrated area who could get health care without a wait in just 15 minutes or less.
Well, it's all in the planning, of course. So you decide to locate FastCare near CC's Pizza so you can get an all-you-can-eat lunch every day when you're working there.
We did that for you, Jim. We realized that you are on that
that's
CC
enough.
Pizza diet.
Tom Cole is our guest here today on Health Talk, and we, of course, have heard Tom several times talk about the benefits of FastCare, but what about somebody who's actually gone there and used it? That's the case for our next call right here on WHAR. We're going to go to JB. Good morning, JB.
Good morning.
How are you? You've used FastCare?
Yes, I have.
And tell us what your experience was, and first of all, why you chose to go there as opposed to maybe an emergency room or hospital.
Well, I actually despise going to the doctor. It's always just such a long wait between the long lines in the waiting room and then waiting for the doctor himself. It seems like it's always, like a half-day commitment of my time. So I just hate going to the doctor. So several years ago, a good friend of mine suggested Mon General's FastCare, so I thought I'd give it a shot, and I was just amazed with the results. I never had to wait more than 10 or 15 minutes for the whole process. It was just fantastic.
Your experience sounds similar to mine in that it seems oftentimes the doctor's office time is more important than our time. I mean, we leave time from work to make our appointment. We wait in the waiting room. Then they put us in the little room, and then we wait for the doctor to see everybody else when he finally comes into your room. So I understand your frustration in that regard. And I think with a $52 cost straight off the board, too, that helps people that have little or no insurance, and perhaps $52 is affordable out of pocket. Right, Tom?
Yeah, that's one of the big factors in it. And anymore, I mean, it's for the employers out there, it's a good option to encourage especially the self-insured, to encourage their employees to utilize it. I mean, it's a huge money saver for everybody. And I think everybody's well aware with all the political going-ons right now around the focus on healthcare in general. This is a good option. It's a good thing to help bring healthcare costs more in control. $52 versus going to the emergency room, which can typically be the $400 to $500 range, is a big difference.
And I know from talking to you in the past, too, that with drug testing offered at FastCare for employers, they can certainly, I think, lower their overall premiums. It depends on your insurance company, I'm sure, but if you have a number of employees who work in safety positions or need to be drug-free, you can certainly get those services done through FastCare.
Yeah, absolutely, and you bring up a good point there. We're offering a service. We've partnered with a company called eScreen, which is a national testing company that offers drug screening. So FastCare, that is the third site for Mon General. So we started utilizing eScreen as a option for our employees through the pre-employment process and expand it upon that and use it at another location and now at FastCare. So again, great option for employers to screen their employees both pre-employment and on an ongoing basis even.
JB, did you get a chance to shop for anything after your FastCare appointment?
Yeah, I mean, it's right there in the grocery store.
Yeah, so I know where it is. You went to the meat aisle or went to the beer aisle, or where did you go?
That's right. Well,
milk and cookies, JB. Just tell him milk and cookies.
It's really convenient with the pharmacy right there, so if I need to fill in prescriptions, I can just fill it right there at Giant Eagle and just do it all right there in the same spot.
And I can tell you the biggest benefit, too, the people at the pharmacy, the pharmacists, are familiar with the handwriting of the person who wrote the prescription because they see it all the time. So you don't have to have what do they call those, Greg? Those people that decipher handwriting? Calligraphers?
Calligraphers, I think that's correct, Jim.
Okay, well, anyway, there are so many reasons why you should consider FastCare next time you need some help. We're going to take a break, and we'll be back in just a moment. You're listening to Health Talk on WAJR.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Tom Cole. FastCare is located at Giant Eagle at University Town Center, open during the grocery store's business hours for the most part. I mean, if the grocery store is closed, you can't go into FastCare because you'd probably wander over and try to, take some beer or something. Well, Greg would. So keep that in mind. And again, what are some of the general maladies that we have that we would be able to go to FastCare and get treatment for as opposed to going to an emergency room?
I would say probably the biggest would be the cold, the flu, sinus infections, strep throat. We see a lot of patients with urinary tract infections, which we do the lab testing on site for that.
So no x-ray stuff, no broken bones.
No broken bones, no suturing, so we don't want, the guy coming in there that needs his arm reattached or anything like that.
Well, they do that down back in the butcher's shop in the meat department, right?
Yeah, we tend to send them back there for that.
Back to you, Kay.
I have no words after that, Jim. Can the staff on hand at FastCare prescribe medication? Can they write out for medications?
Absolutely, yeah. They do prescribe medications. They are supervised. All the mid-level providers there are supervised by a physician within Mon General Emergency Department. They kind of work hand in hand together. So in the event that you would go up there and present with a problem that was outside of their scope of practice, they work hand in hand with the emergency room. They'll try to send or recommend the patient go there or call 911 and have the patient taken to the emergency room. In the event that happens, there's no charge if the patient ends up going to the emergency room from FastCare.
And again, I'm sorry, Jim, go ahead.
Talk about the privacy there because people are shopping and we don't want them seeing us getting any treatment done by a doctor.
He told us they have a door. They have a door.
Yeah, they have a closed exam room, so it is private.
What I'm leaning to is are your magazines up to date?
There's a door.
Yes, they are.
Your magazines are up. Is there a little waiting room or something with magazines, and they're up to date? Because really, you just have to go down to the magazine aisle and pick up some stuff, right?
Well, we tend to have them there for the patients when they come in. So there is a little private waiting area. It's behind the wall, so people within the store really can't see what's going on.
And your address label is marked out so we can't see where you live?
That is correct.
Okay, because I know that's important in doctor's offices and places like FastCare. And again, fairly quickly seen. You said there's no appointment needed, but we can be seen fairly quickly?
Typically 10 to 15-minute range.
Greg, you want to add something? Your mic's on.
No, I was just going to add, we had the gentleman that called in earlier, a male, I don't know, 30, 35 years old, whatever, I'm not sure. But, the vast majority of the people, or the significant amount of the people who go to FastCare are women, are busy women, busy lives, are employed near that area. Maybe they have young kids or whatever. Little Johnny has a runny nose. It's her that takes little Johnny in for testing or whatever it is.
So they will look at children as well.
Absolutely, yeah.
All ages.
And then she can get her needs taken care of as well. So, the decision makers for healthcare, once again, are women, and they are the vast majority of people who go there. Although the gentleman that called before, he went in there and obviously, as you heard, had great success with FastCare. So it's just so convenient for people to stop in and get in and get out and get back to their life, and healthcare without a wait, basically, for minor issues. And it's a great idea for people who have busy lives.
Thank you, Greg. That was very well put.
What if I don't have $52? I mean, do you help people along the way with that?
Yeah, Mon General offers financial assistance. So in the event that someone was up there and couldn't pay, Mon General will work with those people.
Okay, I think it's important to mention that. Some may not have insurance. Even though $52 is not a lot of money to some, it may play hard to get. So you will work with them on that as well. Again, tell us where this is located, FastCare, and the hours.
Okay, it's at University Town Center, Giant Eagle. As you get off to kind of go to the university, off the exit, there's the Giant Eagle, Sam's Club, Target, all those really nice retail establishments and the restaurants. And Monday through Friday, again, 9 to 8:30, 9 to 7:30 on Saturday, and 10 to 4:30 on Sunday. It's $52.
Even on Sunday. Even
on Sunday. So, if you can't get in to see your primary care doctor, we don't want to take away from their business in the least. In fact, we want to help fuel their business. And so, we make sure that they have the information that they need to continue to take good care of their patients.
You are listening to Health Talk, which is brought to you by Mon General Hospital on WHAR. Tom Cole is our guest. We're talking about FastCare at Giant Eagle at University Town Center, and we'll be back in just a moment on WHAR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Gather around, all you sufferers of allergies, athlete's foot, bladder infections, cold and flu symptoms, cold sores, ear infections, impetigo, whatever the hell that is. I'm sorry. Insect bites, laryngitis, minor burns and rashes, minor sunburn, mononucleosis, which is the kissing disease, right, Tom?
I believe so, Jim.
Yeah. Every teenager had mono once, right? Poison ivy, ringworm. People have ringworm?
I think it's...
That's a dog thing, I thought.
No, I think it's in people.
So if you suffer from ringworm, sinus infection, skin rashes, sore throat, swimmer's ear, and upper respiratory infections, you can go to FastCare.
And more. And more.
Blood pressure checks.
There you go.
Screenings.
You forgot that one.
Immunizations. Flu shots still available. I know all these people around the radio station have been getting sick, but I feel like I got my flu shot and I'm confident I'm not going to get sick. I think a lot of it's in our mind, too. I'm not going to get sick.
But it's not too late. In fact, they were talking about that this morning. It's not too late, Tom, to get a flu shot.
Absolutely not. I mean, it's never too late to protect yourself against it. So, again, if you haven't had a flu shot,
do it.
FastCare has them available, $20. Stop in real quick, in and out.
What about pneumonias? Do they do pneumonia shots?
Yes, they do. They also do the Pneumovax. I'm not sure what they charge for that. I believe it is different than the flu shot, but it's not much different.
Do you need a prescription by your doctor for that?
No.
You don't? Okay.
Most insurances cover the cost of a FastCare visit. The maximum cost will be $52. No appointment necessary. Just walk right in, take a left as you go in the front door. That's the way I would go. Is that the way you go, Tom?
Absolutely. It's located right beside the pharmacy, so.
Yep, so that is very convenient. Well, thank you so much for the information this morning, and I hope people will remember FastCare next time you are ailing and you don't want to visit the emergency room. Think of Giant Eagle, think of FastCare in Giant Eagle at University Town Center, just off the Star City exit of I-79. You've been listening to Health Talk, brought to you by Mon General. Morgantown AM is next on WHAR.